So I am Kirsten Sinclair and I am the owner of Orkney Podiatry and the Hooga Clinic, and we live in Orkney in Scotland, and it's sunny today for a change, so we thought we had to record it. I introduced laser to my clinic in August 2018, and safe to say it's been one of the best things that I have done for my business. I recently had a really good experience in treating my dad, and so he was the perfect person to speak to around the laser, what's it like to have it from a patient's perspective and that type of thing. So this is my dad, who is also known as Brian Flett. So Dad, can you tell me a little bit about yourself, kind of medical history, like a wee bit about your medical background, things that you like to do or are busy doing, just things like that.
Medical background, I suppose, is generally healthy. Obviously a big problem with elbows, which I've started probably more than 10 years ago. At that time, I went to a chiropractor who did seem to sort it for a while, but it came and went fairly frequently. Mm-hmm. But this last maybe year and a half, it's been continuous pain, really sore, well, just a constant problem, I have to say. A simple thing like elbows folded, arms folded was painful. Arms had to be straight to keep the pain away.
And you're a locksmith as well, and I know that I recently gave you a lock to try and tackle.
Yes.
But you were finding that doing that was putting too much pressure on your elbows.
It was just a simple padlock, but it needed a wee bit of tension on it, and I just thought at this moment in time, that's not for me.
It's a no.
Yeah, we tried other things with different chiropractors, but there's one particular chiropractor that did that one thing where you bent your arm almost against the joint, and it was done very quickly, and it was a bit scary, but yeah, it did seem to work. You know,
maybe it was just shock.
Possibly. Scared to say it still working.
But this past year it got really bad again, and you obviously felt like this was needing more attention. Yeah. So you had presumably gone back to your GP about it.
Yes, yeah, I went back several times actually, and they never just said that much on it, to be honest, but maybe about 6 weeks, 2 months ago, he referred me to a bone specialist, and I saw him maybe a month ago. Mm-hmm. He diagnosed it as well as being tennis elbow, mm-hmm. And he said that his preferred option in that would be to give steroid injections.
Yeah.
Which I wasn't very keen on several accounts, but the first one I have to hold my hand up and say that I don't fancy the pain, because I know it's very sore.
Yeah.
So I thought that's going to be a last resort. And I said what else could be done for it, and he said then ice pits, 5 minutes twice a day on an ice pack.
Yeah. So after Dad had been to see the bone specialist, he sent me a message to let me know that he had been diagnosed with bursitis. Because we knew then what we were dealing with, and I had the laser at my disposal, I said, well, why don't we try and laser it? Kind of hands up, podiatry is my thing, not elbows. But the laser is so easy to use. There's got pre-programmed with the different settings in it. It's really like a point and shoot type of treatment. So I knew that because we were dealing with a bursitis and the laser could potentially help with that, and it's my dad, that I would just give it a go and see if we could help him. And also obviously the fact that it was painless appealed.
Yeah, very much.
Before we did the laser, Dad said that his pain score was an 8 out of 10 on both sides. So after we did the lasering, I asked him the next day how your elbows were, and you told me that you had, I can't remember which way around, like which elbow was which.
Right elbow was a 1, and the left elbow was 0. There was no pain whatsoever.
I think both our minds were completely blown by that, maybe.
Yeah. Felt virtually nothing, I have to say. It was just, I practically felt nothing. All you could hear was a wee bit of ticking coming out of the boxes they did, but other than that, you were hardly noticed it was being done, just something being rubbed in your skin.
So a not unpleasant experience.
Absolutely not. No, it's just something you barely notice.
Yeah. And did you have any like increase in your pain afterwards, or like I mean, kind of immediately afterwards and into the evening? Did you notice anything different at all?
Well, I noticed something different immediately after the treatment, because before you even left the house here, it felt so much better. Strange, because my arms felt lighter. Yeah. And just felt a bit strange. I think because I had that pain off and on for so many years, and then constant for a year and a half, at least a year. Then suddenly it was literally gone. It just felt so strange. Yeah. And that felt really strange for days, to be honest.
Yeah. Every time I met you, you were kind of like, this is going to come back.
Yeah, it's too good to be true.
Yeah.
Yeah, it was too good to be true.
And also, like, say, every time I met him, he was going, hi. Hi.
Yeah, well, I could do it. This is the thing.
Yeah. So the laser was a big success for you.
Oh, really? Absolutely outstanding. Success.
I think we're both kind of going, right, when this starts coming back again, we'll have to do it. But so far, so good, it hasn't started creeping back in again.
Yeah, but I mean, I could accept if it even comes back slightly at some point, because we know that could just be sorted.
One final question for you that I didn't warn you about, and that question is, who is your favourite daughter now?